The name primary sclerosing cholangitis, or PSC, is actually pretty straightforward. Primary refers to it not being known to have been caused by anything else. In other words, it isn't secondary to something else, right? Sclerosing means hardening of the tissue, and cholangitis is inflammation of the bile ducts. So with PSC, we have this fibrosis and inflammation of both the intra and extrahepatic ducts, so inside and outside the liver. As these cells around the bile ducts become inflamed, die, and harden due to fibrosis, you get this tightening of the ducts in some areas where there's been serious fibrosis, and then dilation in other areas that aren't as affected. And this leads to the classic PSC sign of this sort of beaded appearance of the bile ducts. These areas of fibrosis in the bile ducts can also be seen on histology and looks a bit like an onion skin since you've got all these concentric rings of fibrosis around the bile duct. So sometimes it's referred to as onion skin fibrosis. Again, with PSC, we don't really know what causes it, right? One clue, though, is that it's been known to be associated with ulcerative colitis, which is an autoimmune disease, and Crohn's disease, which is an immune system-related disease. Knowing this, PSC is thought to possibly be an autoimmune disease itself, involving the immune system's T cells attacking and destroying bile duct epithelial cells. Why they might start doing this, though, is not very well known, and likely happens in people with certain genetic predispositions when they're exposed to some specific stimuli in their environment. Certain genetic factors have been linked to developing PSC. Studies have shown that patients with PSC tend to have in common specific human leukocyte antigens, or HLAs. HLAs are these specific markers on cells that tell your body whether these cells are your own cells or someone else's cells. And sometimes, for reasons that are usually not well known, the body's immune system might think that certain HLAs, or cell surface markers, are foreign even when they're your own, leading to an autoimmune disorder. Specific HLAs that have been common among people with PSC are HLA-B8, HLA-DR3, and HLA-DRW52A. Another piece of supporting evidence for the autoimmune theory is that most patients with PSC have elevated IgM antibody levels in the serum, as well as an antibody called p-ANCA. p-ANCA stands for paranuclear antineutrophil cytoplasmic antibody. So this is a specific antibody that targets antigens in the cytoplasm or nucleus of neutrophils. The paranuclear part means that the antibody targets an antigen around the nucleus. Here's an immunofluorescent image of p-ANCAs. The antibodies in this image are shown in orange. And notice that they've sort of aggregated around the nucleus, meaning that they bind to an antigen around the nucleus, right? A very high proportion, as much as 80%, of patients with PSC have this p-ANCA staining pattern. Symptoms of PSC are similar to the symptoms of obstructive jaundice, since these beads or pinched areas are obstructing the flow of bile, right? Also, as these epithelial cells lining the bile ducts die off, bile can now be allowed to leak out past the cells into the interstitial space, where it can access the bloodstream. This causes symptoms related to the components of bile being in the blood, like pruritus, where bile salts and acid deposit into the skin. Also, since bile is in the blood tests will often show elevated conjugated bilirubin levels, which is a major component of bile. They'll also often find increased levels of alkaline phosphatase, or ALP, and gamma-glutamyl transferase, or GGT. These are two enzymes found in the liver cells, or hepatocytes, that can be released into the blood as those hepatocytes that line the intrahepatic ducts are damaged. Now, as the body tries to filter the conjugated bilirubin out of the blood, more will start showing up in the urine, which causes bilirubinuria. Typically, in the urine of healthy individuals, there's a small amount of a compound called urobilinogen. This urobilinogen is produced when microbes in the gut break down bile, and then some of it is reabsorbed and excreted through the kidneys. Since bile flow is obstructed and less is making it to the gut, patients with PSC often don't produce and recycle urobilinogen, and therefore it won't show up in their urine. It's important to remember that even though the bile is getting into the blood, urobilinogen is not getting into the blood, because the bile needs to make it to the gut first for urobilinogen to be produced, right? Finally, an endoscopic retrograde cholangiopancreatography, or simply ERCP, can be an effective technique that uses an endoscope to traverse down through the esophagus, the stomach, and the duodenum, and finally into the bile ducts. Then contrast medium is injected into the ducts and x-rays are taken to look for narrow areas or blockages. PSC can also cause complications involving the liver, because remember that the intrahepatic bile ducts are really close to the portal veins. So as fibrosis builds up around the bile ducts, it constricts the portal veins as well, and higher pressures develop in the veins, leading to a condition called portal hypertension. And this can cause backup of fluid in the spleen and liver, and therefore cause an enlargement of both, also known as hepatosplenomegaly. Over time, as fibrosis and scar tissue progress in the intrahepatic bile ducts, patients can develop cirrhosis, where the liver stops functioning right from this damage. And due to the constant damage to the bile ducts, patients often have a higher risk of cholangiocarcinoma.
As far as treatment goes, although a wide variety of immunosuppressive and anti-inflammatory medications have been studied, unfortunately there haven't been any that have proven to slow the progression of the disease. Liver transplant, however, is the treatment of choice for patients with advanced liver disease as a result of PSC. Thanks for watching. You can help support us by donating on Patreon or subscribing to our channel or telling your friends about us on social media.